Welcome to this educational video on cystic fibrosis, a complex and often misunderstood genetic disorder. In this video, we'll explore the causes, effects, diagnosis, treatment, and management of this disease, providing a comprehensive overview for better understanding. Cystic fibrosis, or CF, is caused by a mutation in a gene called the cystic fibrosis transmembrane conductance regulator, or CFTR gene. This gene provides instructions for making a protein that functions as a channel transporting chloride ions across cell membranes. These channels are crucial for regulating the flow of water and salt in and out of cells lining various organs, particularly the lungs, pancreas, liver, intestines, and reproductive system. When the CFTR gene is mutated, the resulting protein is either defective or absent, disrupting this on-transport process. Inheriting two copies of this mutated gene, one from each parent, is necessary to develop cystic fibrosis. Individuals inheriting only one copy are carriers and typically do not experience symptoms. The core issue in cystic fibrosis is the abnormal transport of chloride and water across epithelial cell membranes. This malfunction leads to the production of abnormally thick and sticky mucus in various organs. In the lungs, this thick mucus clogs the airways, making it difficult to breathe and trapping bacteria, leading to chronic infections, inflammation, and eventually lung damage. In the pancreas, the thick mucus blocks ducts that carry digestive enzymes to the intestines, impairing the digestion and absorption of nutrients, especially fats and proteins. This malabsorption can lead to malnutrition and growth deficiencies. The liver and intestines can also be affected, leading to liver disease and bowel obstructions, respectively. In males, the vas deferens, the tube that carries sperm, is often blocked by mucus, causing infertility. Cystic fibrosis is one of the most common life-shortening genetic diseases in Caucasians. It affects approximately 1 in 2 500 to 3 500 white newborns. While less common in other ethnic groups, it still occurs in African Americans, Hispanics, and Asian Americans. Because affected individuals must inherit two copies of the mutated gene, carrier rates are much higher. It's estimated that about 1 in 25 white individuals are carriers of the CF gene. The signs and symptoms of cystic fibrosis vary from person to person and can range from mild to severe. However, some common symptoms include persistent coughing, wheezing, shortness of breath, and frequent lung infections like pneumonia or bronchitis. Digestive symptoms include very salty, tasting skin, poor growth or weight gain despite a normal appetite, frequent greasy, bulky stools, and chronic constipation. Nasal polyps and sinusitis are also common. Over time, individuals with CF may develop complications such as diabetes, liver disease, pancreatitis, and infertility, particularly in males. Diagnosing cystic fibrosis typically involves a sweat test, which measures the amount of chloride in the sweat. Individuals with CF have higher than normal levels of chloride in their sweat. This test is usually performed after a newborn screening indicates a possibility of CF or when symptoms suggest the condition. Genetic testing can also confirm the diagnosis by identifying mutations in the CFTR gene. Pulmonary function tests are used to assess lung function and monitor the progression of lung disease. Stool tests may be used to assess fat malabsorption. Early diagnosis and intervention are crucial for improving outcomes for individuals with CF. While cystic fibrosis is primarily classified by the underlying genetic mutation in the CFTR gene, there are no specific classifications or types of the disease itself. The disease manifests differently in each individual, influenced by specific genetic mutations, environmental factors, and other individual characteristics. Over 2,000 different mutations in the CFTR gene have been identified, each potentially leading to varying degrees of disease severity. Some mutations result in minimal or no CFTR protein production, while others allow for some protein function. The specific mutation and its resulting effect on CFTR protein function are crucial in predicting the severity and progression of the disease. Treatment for cystic fibrosis focuses on managing the symptoms and preventing complications. This typically involves a multidisciplinary approach, including airway clearance techniques like chest physiotherapy and using devices to loosen and remove mucus from the lungs. Inhaled medications, such as bronchodilators and mucolytics, help open airways and thin mucus. Antibiotics are used to treat lung infections. Pancreatic enzyme supplements are taken with meals to aid digestion. A high-calorie, high-fat diet is often recommended to address malabsorption and maintain adequate nutrition. In some cases, lung transplantation may be considered for individuals with severe lung disease. CFTR modulator therapies, which target the underlying defect in the CFTR protein, are available for some individuals with specific mutations. Currently, there is no way to prevent cystic fibrosis since it is a genetic disorder. However, genetic counseling and carrier screening can help prospective parents understand their risk of having a child with CF. Carrier screening involves a blood test or saliva sample to determine if an individual carries a CFTR gene mutation. If both parents are carriers, they have a 25% chance of having a child with CF, a 50% chance of having a child who is a carrier, and a 25% chance of having a child who is neither affected nor a carrier. Prenatal testing can also be performed to determine if a fetus has CF. The prognosis for individuals with cystic fibrosis has improved significantly over the past few decades due to advancements in treatment and management. While CF is still a life-limiting condition, the median predicted survival age is now in late 40s and increasing with continuing research and development of new therapies. Recent advances include the development of highly effective CFTR modulator therapies that can significantly improve lung function, reduce exacerbations, and enhance overall quality of life for individuals with specific CFTR mutations. Research continues to focus on developing therapies for all CFTR mutations, addressing lung inflammation, and preventing and treating complications. Gene therapy and mRNA therapies are also being explored as potential future treatments for CF.